Lasla, good evening everyone. At the onset, I would like to thank BBS for giving me this opportunity to disseminate information on the vaccine deployment, vaccine rollout plan, and lastly on the public request from the Ministry of Health. As many of you are aware that we have received 400,000 vaccine from the Government of India this morning, and for that I, on behalf of the Royal Government of Bhutan, would like to thank Government of India. Special thanks to His Excellency the Prime Minister Narendra Modi ji for his unwavering commitment to Bhutan and making the nationwide rollout a reality for Bhutan. With that, I want to briefly talk about the vaccine deployment plan, and then I will go on to explaining the whole vaccine implementation framework, which will then be followed by the public request from the Ministry of Health. As you are all aware, as of today, this evening, we have a total of 494,000 people registered for the vaccination. That accounts to about 92% in terms of coverage. And then from the 494, the eligible population that will be used as a denominator it comes to around 397,640 Bhutanese who will be eligible for the vaccination. As of now, Ministry of Health has identified 1,001 vaccination sites across the country, from which there are 363 schools and few ECCDs that has been identified as vaccination site. Now moving on to the deployment, as we speak, my team is at the Ministry of Health looking at the deployment plan, and the deployment will start from tomorrow morning. So we have divided the region into 3 regions. So we have the eastern region, the central region, and the western region. In the eastern region, we will be covering 6 districts. 4 districts, the distribution will happen on the 24th. There is a flight going to Yongphula on the 24th, and the vaccine will be distributed, dropped off at Yongphula, and from there the deployment will follow. And in the central region, we have again 6 districts, Tsirang, Dagana, Sarpang, Phumta, Tonsa, and Shamgang. And the deployment for these vaccines will start on the 24th of March. I'm happy to inform all the refrigerated vans are currently here in Thimphu and use from the respective districts, and we will be deploying them on the 24th. Now for the western region, that includes 8 districts. So we have Chukha, Samchi, Wangdi, Gasa, Punakha, Paro, and Thimphu itself. The deployment will start from tomorrow onwards. Following the deployment, as the nation is well aware that we have the National Immunization Technical Group, they have decided to cluster our vaccination site into 140 clusters. And in each clusters, we will be posting a doctor, temporarily posting a doctor to basically oversight the immunization process and the procedures, and if there are any adverse reaction, to manage these adverse reaction in their respective clusters. For that, we will be remobilizing around 41 residents from the PG program here at the JDW NRH, and they will be leaving along with the vaccine supplies. And for monitoring purposes and safety, we have also identified 3 regional technical advisory group that will be housed in Mongar Referral Hospital. Another team will be housed at Gilifu Referral Hospital, and the national team will be housing at the National Referral Hospital here in Thimphu. Now I want to briefly talk about the vaccination rollout plan. As informed by His Excellency the Prime Minister earlier, The vaccination rollout will start on the 27th of March from Thimphu, during which the ladies who was born on the Maghi year will get inoculated first, followed by His Excellency the Prime Minister, who will be in quarantine, and then relatives of Prime Minister and few of my minister colleagues will get inoculated during the first day of the immunization rollout, and subsequently on that day it will be rolled out nationally across the country in all 20 districts. I am informed that in each districts they have planned their own programs and then the rollout activities. Now, when we go into the categories of people that will be inoculated during the campaign mode, we have pregnant mothers and lactating mothers. If they wish to get immunized, we will be offering the vaccine to pregnant mothers and lactating mothers, especially our frontline workers who are pregnant and lactating. And then when it comes to our health worker and active frontline workers, health workers who are engaged in the vaccination campaign will be immunized at a later date after the end of the 7-day campaign period. So the 7-day campaign period, once it ends, then we will immunize active frontline workers who are engaged in the vaccination program. Rest of the health worker and the frontline workers should be able to avail vaccination services at any time of the day within that 7-day campaign period, Now, you know, we really looked at the data, and as of now, nationally, there are about 1,200 individuals who cannot walk. For that, we have already done a line listing, and for these people with disability, we will be providing home-based immunization option, and that too will happen after the 7-day campaign period. And similarly for elderly patients. So elderly, anyone above 70 years old will be inoculated in a health facility. And I say health facility because it will either be inoculated in a primary healthcare center or in a hospital or in a referral hospital, depending on where he or she is residing. So all these activities will happen at the end of the 7-day period. Then we have a cohort of people who are institution based. So we have monks who are in the institution, we have college students who are in the institution, training institutions. For those people, we will also be offering the vaccination after the 7-day campaign is over for the general population. So that's a cohort that will get after 7-day campaign period as well. Now it will really depend, each district they might be able to adjust a bit, because it will really depend on what is the size of the population that they are working with, and the size of the population in the elderly population and population in the institution. So they might finish the 7-day inoculation on the 5th day and start these cohorts early on. So it will really depend on the individual districts as well, given the diversity in population and the group of categories of people that needs to be immunized. Now I also want to quickly touch base on the adverse reaction, adverse event following immunization, which is also commonly known as AEFIs. I think I'm quite sure that Prime Minister has touched on this topic many times, that people would experience some adverse reaction which is very normal, such as, you know, soreness on the site of injection, fever, headache, fatigue, muscle pain, nausea, chill, a little bit of cough. All that is very much a part of the inoculation process. But we would encourage people to report this. Even if it is not a major concern, we would like to document these adverse reactions so that it provides some additional scientific knowledge to the vaccine developers as well. Adverse reaction, of course, will be reported to the respective doctors. So when the immunization program is rolled out, we will have, you know, two categories of people. People who have already been registered will be following one line, and the people who are not registered will also be registered on site during the vaccination program. Once you have verified your registration, the information that you have provided on your health medical conditions will be re-verified by our health worker, and once that is re-verified, you will go and get your inoculations done. And then after that you have to wait for half an hour so that we can observe you for that half an hour. So if there are any serious anaphylactic issues, that will come during that first half an hour. So that's why we would like to observe you for the half an hour, and then after the half an hour is over, you will be released with an election black mark on your left thumb, and that will indicate that you have already been vaccinated. And with that, although we have no inter-district movement, you should be able to travel with the after the inoculation. So that's another thing. And with regard to schools, the schools that we are using for as a vaccination site, those schools will have to remain closed, but the rest of the schools can be open. And similarly for offices, they will remain open. On the weekends, we would give preference to people, civil servants and office goers who will need to be vaccinated early. And if you want to get vaccinated during weekdays, you will be allowed to leave work and go and get your immunization done. Now, in terms of what to bring during your vaccination, any form of identification will be good. If probably the same identification that you have used for registering for the vaccine earlier, we will then, based on that identification, we will verify the information. People who don't have identification, we will still be providing services to those people. So basically, any eligible population residing in the country should be able to get get immunization during the campaign period. Of course, we are working very closely. So once we have finished the campaign period and the mop-up for elderly, for people in institution, and health worker who have actively been engaged, health worker and frontline workers who have actively been engaged in the frontline work during the vaccination campaign will get immunized during the what we call a mop-up period that will happen after the 7-day period. Now, if there are still some people who would like to get immunized, then they should be able to avail services in their nearest health facilities. Because of convenience, we might dedicate a day where you can come and get immunized. So it may not be same as the campaign mode because a vial contains 10 doses, and if we use one, then we waste 9. So that is something that we would like to keep in mind. So we would probably list you all, and depending on the number of individuals coming forward, then we would probably give you a date for you to come forward. For us to achieve the maximum benefit of rolling this out within a week's period is to achieve herd immunity. Say around, if you can achieve 75% coverage of your vaccine, then you have a good herd immunity. that not only protects you, your loved ones, your community, but nation at large. So this is where we would like to encourage people to come forward, as many of you are well aware that it is the vaccines are very safe. For that matter, I think on the very first day, Prime Minister himself is putting all his relatives and loved ones in the forefront, including his elderly parents, his elderly grand-in-laws, his wife, his siblings, his relatives. So this is how safe it is, and this is how confident we are. So we once again would like to appeal to the people that please do come forward for immunization, because this is not just it's your ultimate responsibility and duty towards the nation. So with that, I would also like to remind people that we still have the risks of COVID transmission. So while you come forward for immunization, we would like to once again remind public that you must follow the preventive measures of using face masks, hand washing, maintaining distance, and not crowding up the place. We will try to do our best. We are working very closely with DSUP to manage crowd and to also space out our immunization by cluster. So as we provide instruction to the respective districts, they will then work with their stakeholders in the district to map out a micro plan that will detail all these logistic issues. And similarly, as mentioned earlier, that there will be inter-district movement restriction, not within district but intra-district movement restriction, and that will apply for only people who have not been vaccinated. If you have been vaccinated, basically a mark on your left thumb, then you should be able to travel from one district to another. And then schools, of course, all schools that are not being used for vaccination site will remain open, and students should be able to continue their studies. And I would also now lastly highlight that if you have not been vaccinated, then there are also certain inconveniences that you may have to undergo, one being random testing or regular testing. So the person who is eligible but have not been vaccinated will be under the Ministry of Health surveillance, which means that we would test you on some level of frequencies. If you are required to go to other district, we might require you to get tested prior to going to that district. Plus, if you are visiting hospitals, we would also test you. So testing is one of the inconvenience that you may have to face. This is again to protect our community from undergoing yet another outbreak. So these will, of course, and then I think that ultimately not many countries have formalized it, but most are still talking about having a requirement for vaccine passport. So which means you have to prove that you have been vaccinated for any international travels. So that will again provide you with another inconvenience. So with that, I would like to once again encourage our public to come forward for the vaccination. And last but not the least, today, as you all were aware, we have concluded our 3-day medicinal Buddha chanting and rituals this morning performed by His Eminence the Doji Lebe and Lexo Lebe. So Ministry of Health remains immensely grateful to the unwavering support rendered by our Shundasa, and all the prayers and the blessing, and lastly, we remain forever grateful for His Majesty's continuous guidance, love and compassion for the people of Bhutan. So thank you very much, and Tashidele.